Introduce Dr. Glen Davies. Glen is a registered psychologist specializing in clinical child psychology and has much expertise with children with disabilities. He has served on provincial level committees regarding diagnosis and treatment for children with disabilities. He was an expert witness in the Autism litigation. He is also active as a professional advisor to several organizations representing children with disabilities, including FEATBC and Autism Society BC. In 2002, Glen was the recipient of the humanitarian accommodation from the BC Psychological Association for his work on behalf of children with disabilities. It's also important to note that Dr. Levy is in good company because Dr. Davies is also a member of the Loyal Order of the Flying Swine. He is the director of Able Developmental Clinic, which is a private, multidisciplinary clinic serving children with attention, behavior, learning, and emotional difficulties. Beyond this, he genuinely cares about the well-being of our children and our families. Ladies and gentlemen, Dr. Glen Davies.
Thank you. I'm so honored to be here today, and I'm just delighted with the number of people that came out for this very, very important conference. I've been asked many times, mostly by professional colleagues, about why I've gotten so involved in this area. And I'd have to say that part of the reason is for little moments like Friday, running into Bev Sharp and her daughter Allison at the video store in our neighborhood and hearing her say to me, "Hello, Dr. Davies." I've known Allison for a long, long time, and I didn't ever think I would hear those words. So, this little moment. When I first entered this field 25 years ago, autism had a very bleak prognosis. We didn't understand much about this condition. There were essentially no effective treatments, and autism was viewed as a chronic and largely untreatable condition. When I made a diagnosis, at that point in time, I had to sit down with the family and try to prepare them for a life of disability and a life of dependence. Only about 1 in 50 kids with autism attained the normal level of functioning at that point in time. It was a very dark time. The only thing that was good about it was the fact that we thought that autism was a rare condition. At that time, and for the 4 decades preceding that, we saw autism as occurring about 4 times in 10,000 kids, a rare condition. And many of you know that that's not the case at all. And Dr. Levy spoke to this earlier, that the prevalence of autism is going through the roof. What was once 4 in 10,000, by the year 2000, we were looking at about 40 in 10,000, about a 10-fold increase. And now we're up approaching about 100 in 10,000 kids, which is just under 1%. That's a staggering increase. Now, part of that increase is because we finally have some effective treatment for autism, and we've lowered diagnostic thresholds so that we can identify more kids and help more kids. But even when we hold those diagnostic criteria constant, the number of children with autism is going through the roof. It is a public health issue of a huge magnitude. Now, there has been a ton of research recently trying to understand the nature of autism. And many of you I know have heard about genetic studies and studies of neural pruning and brain overgrowth and neurons and so on. All very exciting research. But the most important thing in my mind is that we have effective treatments for autism. And that effective treatment is in fact intensive behavioral treatment. When I started 25 years ago, remember, 1 in 50 kids seem to reach normal levels of functioning. Now what we're finding is somewhere between 10 to 20 of those 50 kids are reaching normal levels of functioning, and 40 out of the 50 kids are making substantial gains with this kind of intervention. That's very effective treatment. Now, it doesn't get much better than that in my field. It really doesn't. I was in grad school when Lovaas published his first studies, and his claims were extraordinary, and like most people, I was skeptical. It ran completely in the face of what we knew about autism at that time. I'm a social scientist by training. I read that research. I read the studies that followed it up. I understood at an intellectual level that these kids were improving, that there was an effective treatment there. But it wasn't until I saw with my own eyes little children essentially transformed by this therapy that I was moved in my heart to the point where I just could not turn my back. You just have to do something when you see outcomes like that. It just isn't right in Canada that we don't have autism treatment for all kids at all ages. It isn't right that we have autism treatment rationed as it is currently. I believe, as many of the people in this room believe, that we won't see fair, responsive, and non-ration treatment for autistic kids until autism is part of the Canada Health Act. Thank you. When you see your physician, he or she has the authority to spend some government dollars on your behalf right then and there. If you need X, you get X. There's no way that a physician has to present a proposal, has to get together with a government bureaucrat and develop a written proposal to be submitted to another analyst to be judged worthy or not. It just doesn't happen that way, and it shouldn't happen that way in the autism area. Treatment needs to be needs-driven. Now let's face it, the reason for all of these bureaucracies is about saving money. It's about cost containment. That's what the government is looking for. But nobody in their right mind would ever volunteer to do ABA treatment for fun. It's not fun. It's hard work, right? It's expensive, it's time-consuming, you lose privacy in your own home. It's a very difficult thing to do. Parents don't give their healthy kids insulin. They don't give their healthy kids interferon. They don't give healthy kids ABA therapy. You give the kids ABA therapy who need the therapy. It's not that open to abuse. I don't understand the government's concern in this regard. The other thing is that, and we have a presenter coming in a few weeks, Dr. Mullick, who will be presenting on this issue. But the evidence shows that for every dollar that you spend for treatment in the autism area, you're going to save $1.50 to $2 in terms of ongoing costs that you save. It is not only the right thing to do, it's the judicious thing to do, and now's the time to do it. Thank you.